I came here to New York, and when I arrived, everything like, oh, this is my moment. When I arrived, everything was dead. There was nothing. Times Square was like apocalyptic, so to speak. There was nobody around. And then I was like, oh my God, is this going to be my experience? It was really isolating.
Yeah, at the beginning, I guess, I was a bit optimistic in terms of, oh, this is gonna end soon. So the fact that it became so long, it's when it became way more complicated.
During the pandemic, everyone lost everything. We lost our social life, our daily routines. And the campus life is a social experience for students that was all taken away. They were just in full-blown depression.
Rates of anxiety and depression, even before the pandemic, were found to be 6 times higher than the general population. In 2017, 2018, approximately 39% of students were moderately to severely depressed, and 41% of students were moderately to severely anxious.
And as you can imagine, after the pandemic, things were just like a little bit more intense, were happening more frequently. The duration was a little bit longer. A lot of our students started to experience things like panic attacks like they hadn't had before. Maybe they were experiencing obsessive compulsive disorder, and it caused a lot of distress.
I had just been through a process of grief before the pandemic. So during the whole pandemic, it was that extended period of grief, right? So in my case, I call it like a layered grief.
It's ironic for me. I actually do consider myself an introvert, so it didn't normally faze me. It was who I am, you know. I can go out whenever I want, but when they take that option from you, that's when it becomes kind of like, you know, its own cage. I do realize that ultimately we are social creatures.
The pandemic in the end really changed the way I interacted with people. Focusing a lot on the human, on the bonds I had, it really gave me like a sense of community.
Here, it really helped a lot that I had roommates because I didn't feel alone. I felt like I had people around me.
The biggest key is for people to talk to each other. Talk to anybody. Get on that Zoom call with your family. You don't like Zoom? Get on the Zoom call with your family. When you go to the supermarket, talk to the cashier. When you get in the Uber car, have your mask on, talk to the driver. Just talk to people.
I think it's important to also get more energized and activated. So maybe doing something like yoga or mindfulness or getting exercise back into your life. I think that would be healthy for a lot of people. If all else fails, please seek help.
Don't be shy, like go introduce yourself, use the services. It's usually like a free resource that you have as a student.
Help seeking is an act of self-care, but it's also an act of courage.
I would, recommend that people kind of check in with themselves and really think of maintaining good mental health as like a vital part of what they do.
I think it's something that comes, that's usually repeated. It's very easy to say, like, be gentle with yourself. Don't beat yourself up about things that are not within your control. And I think just finding a way of being gentle with yourself, of treating yourself, that goes a long way.